Hair loss treatment options, part 1. Let's first start with prescription and over-the-counter medications. So the first is Rogaine. Rogaine is also termed as Minoxidil. It's an over-the-counter medication. You generally apply it to the scalp 2 times a day, and what it does is it encourages hair growth and prevents hair loss. It takes about 4 to 6 months to actually see the results. The second is something that's called Finasteride. You may know it as Proscar or Propecia. This is a prescription medication, and it's a pill that's taken daily. You do need to see your physician for this. You must take this for 3 months every day though to see the results. Now both Rogaine and Finasteride can take up to 1 year to see the results. And the kicker here is that you have to keep taking them to maintain their benefits. Once you stop, you'll revert back to where you were when you started to take them. Number 2 is hair transplant. There's a lot of different modalities when it comes to hair transplant, but I'm only going to cover 2 of the most common today, starting with the least going to the most common. The first is FUT. That's also known as a follicular unit transplantation. What this does is it removes the skin on the back of the scalp as a strip, and the reason it's from the back of the scalp is because that's where there's the most amount of hair. The surgeon will then remove the follicles from that strip of skin and then reinsert it into the scalp. The more common approach now is the follicular unit extraction. That's the FUE approach. I actually offer this in my practice. The surgeon removes the hair follicles directly from the scalp and transfers it to the bald or thinning areas of the scalp. This doesn't involve a large incision, your healing time is far less, and in my opinion gives a superior result. Number 3 is lifestyle change. Quit smoking. In 2020, there was a study conducted that had 1,000 men that were divided into 2 separate groups, smokers and non-smokers. In the smoking group, nearly all patients had hair loss. In the non-smoking group, 50% of the patients had hair loss. The study showed that smoking will actually increase your likelihood of having hair loss. So if you quit smoking, you'll minimize your risk of hair loss, but you won't necessarily regrow the hair back. Number 4 is scalp massage. Scalp massage is actually found to stimulate hair follicles. In fact, there was a small study in 2016 conducted in Japan where healthy Japanese men who received only 4 minutes of scalp massage every single day for 24 weeks were found to have thicker hair at the end of their study. Number 5 is making sure that you actually have a very well-balanced diet. You want to consume foods that are iron-rich, such as lean beefs, beans, green leafy vegetables, or iron-fortified grains, eggs. Also, you want to make sure that you're consuming foods that are rich in omega-3 fatty acids. These are like salmon, tuna, egg yolks, hemp seeds, walnuts. In addition, you also want to make sure that you're consuming foods high in protein. Again, these are eggs, your lean meats, seafood, and of course, drink plenty of water. Number 6 is reducing stress. Regularly exercise, listen to music, practice yoga, meditate, get enough sleep. Stay tuned for part 2 where we continue this journey. Thank you.